I wish to acknowledge the Darkinjung people as the traditional custodians of the land on which I work. I pay my respects to the elders past and present and recognise the continuing connection and contribution to the land. Welcome back to MatterofVax. I'm Steph O'Connell. Today we're going to talk about travel, dear to our hearts and probably something we'd all like to be doing more often. But there are lots of risks involved. Knowing what the risk is and how to prevent it can be the difference between a good and a bad experience. And in some cases, it can even mean life and death. Dr. Deb Mills has a passion for medicine and travel. She's a medical director at Dr. Deb, the Travel Doctor, and has been working in travel medicine for 35 years. She's a pioneer of travel medicine in Australia. She's also a researcher and author of Travel Well, a must-have guide to enjoying good health while travelling, which I read is in its 21st edition. Is that right, Deb?
It is. It's Travelling Well, the must-have guide to a safe and healthy journey. I'm very excited that I've found my niche. You know, many people in life never find the job that they're passionate about, and I am so incredibly blessed. So I love going to work. I love talking to my lovely patients. I love helping them have their wonderful journeys. We have so many interesting people going on fascinating journeys. It is just such a fun job.
You're very, very lucky. I have a really big question for you. We've been living in this COVID environment for many years now. We're all getting very used to it. Has it changed how you advise people about preparation for travel?
Look, the big difference, I guess, is people are more careful. People have learned that there are things out there. The travel diseases have not gone away, and now there's COVID as well. We are run off our feet by people wanting to get the right advice, the right medical kits, the right vaccines. You know, they want to take precautions. We have a great cohort of patients, and we are doing a lot of research with those people. We send them an email and say, come and have a blood test to check how long your vaccine lasts, and they all come in. It's just beautiful. So we have found that travel is different because it's more frenetic. There's, I think, a lot more travel than there was before, and people are being more careful.
So COVID's actually had a positive impact on people wanting to prevent infectious disease.
I hesitate to say that COVID has a positive impact in anything because it's just the most feral virus and it does such damage to the body. But I guess humans are a very adaptive species and they want to, you know, come back from drama. And so they have learned a few good lessons. And I think cruise ships are really cleaner now than they ever were. Cruise ships were like petri dishes of disease. So, you know, there's tips and tricks that have improved, and people are now doing contactless checkout in hotels so they don't touch anything. So there's all that sort of stuff, but some things haven't changed.
So with 35 years of experience telling people how to travel well, what's the 101?
Look, the most important thing is to start a bit early. Don't leave it till 3 days before you go. We can do it, but the immune system takes time to take effect and these side effects need to subside. You know, these are vaccines. They're active in your body. You don't want to be getting on the plane with a sore arm. So ideally, 6 to 8 weeks before you go, find out if there's anything you need. And you need to see someone who's actually obsessed with travel medicine, travel health, who knows what you need for the different countries. And you can't easily get it on the web. The web stuff is a bit general and people have medical issues. People have their own personal health challenges, particularly if they have chronic disease, if they're over the age of 50, anyone with any sort of medical problems that can interact with the destination that they're going to. So get good advice. Get advice that's from someone who knows. And what you need is basically vaccines. You need potentially some pills, maybe for altitude or malaria or whatever. You need to get a medical kit. You need to know what diseases to avoid. There are hazards in Australia. We know about box jellyfish and blue-ringed octopus, but there are things overseas which are unique to the destination. So you need to know about that. It's also a good idea to have your general checkups. Make sure you've been to the dentist. Make sure that you've got your medical stuff sorted, that you've got plenty of pills for whatever trip you're going on and whatever medical problems you have. When people come in, there are 3 groups of vaccines that we need to talk to them about. There's the routine vaccines, so the childhood vaccines. And a lot of people think, oh, I had all those baby vaccines, it's all done now. People born between 1966 and 1983 were given 1 measles vaccine and told, that's it, you're covered for life. No, you need a second one. And all children now get 2 measles vaccines. And as a result of COVID, the measles vaccination programs have crumbled and measles is surging. There are people coming back to Australia with measles who've travelled, which is spreading it in the country, but mainly it's just surging around the world. You only have to sit in a room where someone with measles has been 2 hours before, and you will get measles if you're not immune. And measles is miserable. Measles damages your immune system and makes you prone to other diseases as well. You infect your family and friends, can cause really significant long-term problems in adults.
Incredibly infectious, isn't it?
Incredibly infectious. So you need to get your measles sorted. Initially, they said one chickenpox vaccine was enough. Now they've discovered actually it's the same with chickenpox as measles. You need 2. Some people haven't had a tetanus vaccine for many years. Some people have not had their adult dose of polio. We're finding polio in the wastewater in London and New York. Now, that means it's everywhere in the world. So it's recommended to have 1 adult dose of polio, and you can have that with your tetanus. The number of people who come to me who've gone to their GP and got an ADT, which is tetanus diphtheria, and they haven't got the whooping cough and they haven't got the polio. Like, you need the suite. If you're going to have a needle, you want to have everything. You don't want to have more needles. So you need to get those things up to date. And you need to get the routine vaccines of the seniors. So seniors have their own suite of vaccines. Baby vaccines are all very well, and everyone goes, oh, baby's got to have the vaccines. But you actually need vaccines when you're older as well. You need to think about getting the influenza vaccine. Over 65, there's a very high risk of getting hospitalised with the flu. So you really want to have the current flu vaccine before you go, if it's available, depending on when you're going. And luckily, the Northern Hemisphere and the Southern Hemisphere flus are often very similar. So that's at age 65. And in Queensland, it's actually free for everybody at the moment. If you're 65 and over, you really need to have a shingles vaccine. The shingles vaccine was $300 a dose, and you need 2. And now, blissfully, it's free. Shingles is the most miserable disease. It sits in the nerve endings, quietly biding its time for 50 years. And one day when you get run down or you get sick or a family member dies and you're really stressed or work is just driving you crazy, and so it comes out along the nerve, it can cause persistent pain for months or years afterwards. It can hospitalize people, and 1 in 3 people will get it. And you can get this vaccine, 2 shots given 6 months apart. Yes, it makes people feel a bit crummy the day they have it, but no worse than COVID vaccines. But it's a small price to pay for not getting horrible shingles, which is just debilitating. So having a shingles vaccine if you're over 65 is not optional in my view. The other one is the pneumonia vaccine. Pneumonia is an infection of the lung, and the immune system is not as good. If you're 65 or 70 and you've looked after yourself beautifully all your life and you've not eaten junk and you've exercised and you've done all the right things and you feel fighting fit and you're going to walk the Camino and you think, my immune system's just like it was when I was 40. No, it's not. Your little white cells have done a lot of work in their life and they are getting tired. They are not going to recognize this nasty little pneumonia germ when it comes waltzing by, and they're going to sort of look at it and go, oh, yeah, instead of jumping on it like they would have when you were 20. So people in their 70s get pneumonia and die, even though they might feel perfectly well and be living a good and healthy life. So a pneumonia vaccine at age 70 will give your immune system a little bit of a tickle along and make sure that it's not going to succumb to this wretched virus. Who wants to die of pneumonia? Get your vaccine and it doesn't happen. And it's free. So flu, shingles, pneumonia, and of course making sure your tetanus is up to date. All these things should be done for seniors before they get on a plane, even if they're not leaving the country.
And there are countries where some vaccines for entry are mandatory. Is that correct?
Yes. So there are 3 groups of vaccines. We've talked about the routine. There are the required, which are those ones where you have to have them to get into the country. And there are the recommended. And the required ones are generally yellow fever vaccine if you're going to Africa or South America. Now, there's a thing about the yellow fever vaccine that people do not realise, and they need to know about this, because if you have the vaccine and you're over 60 and even over 50, but mainly over 60 and 70, it has a lot more side effects. So anyone who wants to go to Africa or South America, and anyone who's going to go on really powerful anti-immune system drugs should seriously consider having the yellow fever vaccine before they get to the point where they really need it. Like they might have the vaccine early, because the yellow fever vaccine is valid for life, provided you have it when you're, healthy. So anyone who wants to go to Africa or South America in their retirement should probably think about having the vaccine in their 50s and not wait. anyone who's going to go on rheumatoid drugs or any of the high-end, we call them DMARDs, they're basically anti-immune system drugs, needs to have the yellow fever early because the yellow fever vaccine is live. So if your immune system is not up to speed, the virus gets in and runs amok, and there are people who have died or got really sick from having this vaccine. So we have to get special approval to give a yellow fever vaccine as a doctor, and having the yellow fever vaccine when people are healthy is very important. So that's one that's required. Some other countries will require vaccines, like polio is required for some countries, meningococcal vaccines required for certain types of travellers if they're going to the Hajj and so on. That's basically the required vaccine. And now with the Australian Immunisation Register, I would strongly encourage all your listeners to make sure that all their vaccines from henceforth go onto this register, because it's impossible to remember your vaccines. So now you can have these very impressive vaccine printouts from Medicare, which run to 2 or 3 pages, but it's tremendously useful when you travel to have all those vaccine records, because things like hepatitis A, which we'll talk about in a minute, 2 shots and you're covered for life. You don't want to lose these vaccine records, because otherwise Hep A vaccine's $100. You don't want to be paying that if you don't need it. The third group of vaccines is the recommended vaccines. And they're actually the tricky ones, because people say, oh, they're not mandatory, so I won't bother having them.
Yeah.
Things like typhoid, hepatitis A, meningitis, rabies, tick encephalitis vaccine, Japanese encephalitis vaccine, which interestingly enough is now broken out in Australia. All these vaccines are recommended, and you really want to consider what your risk is. So you go to, say, a travel doctor or whatever, and they basically work out where you're going, what activities you're going to do, what your past medical history has been. If you've got no spleen, your risk of getting disease is much higher. If you've had high blood pressure, all that sort of thing feeds into what vaccines would be recommended for you. And then the doctor says, okay, for you, the risk of, say, hepatitis A is very high. You have 2 doses of vaccine 6 months apart. You're covered for life. You need it for every country in the world. It's a very good idea. Whereas something like Japanese encephalitis, the risk is maybe 1 in 100,000. It's very rare, but if you catch it, you die or get permanent brain damage. If you're going to be in rural areas, it's a good idea. If you're going to be shopping, no, it's not. So you need these kind of risk-benefit discussions that are individual to your trip and your history and your budget, because some of these vaccines are really expensive. They really need to think about what it's going to cost, because it's very expensive to get sick. You really want to pay for the vaccines that you need, but of course you don't want to have things that you don't need. One of the most underrated vaccines, if you like, the underrated disease, the disease that Australians don't know about, is rabies. Rabies is the most common reason I get stressed phone calls from overseas.
Wow.
People ring me and say, oh my gosh, Dr. Deb, I've been bitten by this dog. I'm in Ecuador. I can't get access to the vaccine. What am I to do? Rabies is a fatal disease. If you do not get vaccinated within 48 hours of being bitten, you die. So the thing with rabies is, if you're bitten by a mammal and you've had nothing before, no practice for your immune system, you need to be vaccinated that day. And you need to get this product called RIG, which is rabies immune globulin, which is instant antibodies to rabies, which is injected into the wound to neutralize the virus. Because that virus is in there trying to find a nerve so it can swoop its way up the little nerve fibers into the brain and cause the problem. So you've got to get this RIG into the tissues very quickly after the bite. And then you give people lots of vaccines really quickly so they will make antibodies to stop the virus in its tracks. The only thing that stops rabies is your own antibodies. So if people have had nothing before, it's this horrible amount of treatment that they need. Now, getting rabies immune globulin RIG in developing countries is not going to happen, because they're not going to have $1,000 vaccines which expire sitting in fridges. Now, if you have vaccines before you go, so you can have 2 shots given about a week apart, then if you're bitten, you've got a week to get to a doctor instead of having to do it that day. You don't need the RIG, you just need vaccine, and you need 2 doses of vaccine, day 0 and day 3. If you're pre-immunized, if your immune system has had practice with rabies, it's had priming, it knows about this virus, it's so much easier. So people who frequently travel into Asia, Africa, South America should really consider having rabies vaccine.
So, Deb, when I listen to the required, the recommended, it's a long list. So seeing your fully fledged travel doctor sounds like incredibly good advice, but it may mean that you're getting several vaccines. If I was to go traveling this year, I can see I probably need to get a couple of older vaccines, as you were saying, get up to date with some that I may have had as a child. Booster for whooping cough would be a good one to have as well. There's a variety of other vaccines that might be required. Is 6 weeks, 8 weeks long enough before I travel to get all of the vaccines that probably I will choose to get?
Look, unfortunately, the first time you go and see about travel vaccines, there's a lot of catching up to do. People haven't had their baby stuff. They might not have had their hepatitis A, that kind of thing. So they might have to have a couple of visits. We don't do it all in one visit. I think my nurse said to me
Right.
the record that she's ever given is 9, but the most we normally give in one day is 3. And so when we work out what vaccines are needed, we then need to work out a schedule, because some vaccines you can't have with others.
Yes.
Some vaccines have to be given together. Some have to be given, 2 or 3 weeks apart. And that's where we've got to first plan what people need, and then we plan the schedule.
So, Deb, aside from vaccines, there's other ways to prepare. What should we be doing?
Oh, look, really good question, Stephanie. The thing is, there's information people need. They need to know how to not get sick, what to do if they do get sick. They need to carry with them certain medications. So things like altitude pills, jet lag pills, malaria pills might be needed. They need to carry gastro pills. We have this combination of pills we call the bomb. And the bomb is a combination of an antibiotic and a stopper. And the combination of those two will knock most travellers' diarrhea very quickly. Now, you need different antibiotics for different countries, so you need to know which is the right one for the country that you're visiting. But having these pills with you, during the day, on the plane, etc., means that if you do get gastro, you've got the means to treat it. The average person suffers with gastro for 4 days. If you take the pills, it's probably going to be 1. So it's much better to have these medications with you just in case, but that's a whole nother story.
So, Deb, if I've got this right, there's the routine, the required, and the recommended. And if you do that, if you take care of those 3, then you're probably going to have a safe trip.
Absolutely, Stephanie. Look, that is the key thing, those 3 groups of vaccines. And remember that the first time you go to a provider, you get all this stuff. But once you've had all your catch-ups vaccines done, second and third visits are a picnic. People think, doctors are going to go crazy and just keep giving me vaccines, but it's not the case. They just need to get all that stuff caught up. Most of the vaccines are valid for life, so you don't need to do it every trip. It's just the first time.
Great advice. Deb, I want to thank you. I don't think I was quite aware of just what a minefield travel and preparation really is when you're serious about prevention. And I think a lot of our listeners on MatterofVax are very serious about prevention. Getting the information early sounds like it's absolutely key so that you can book yourself in to see a travel doctor and be ready for the fact that you may need to go more than once to be prepared for your trip, and you may need to do a little bit of catch up. I think they're the take homes for me. Thank you very, very much for joining us. It's incredibly valuable to have someone with your breadth of knowledge and unbelievable experience. It's an absolute joy to meet you. Thanks for joining us.
Oh, it's my pleasure. And bon voyage to all the listeners.
Thanks for that, Deb. If you are an Australian and you want to know more about travel, one of the best places you can get information is smarttraveller.com.au. Find out more about health risks and mandatory vaccinations required for entry to your destination. You can hear more about travel as well as videos on this subject and more at ifa.org.au. I'm Steph O'Connell. Thanks for joining us at MatterofVax.
Immunisation Foundation of Australia. Supporting immunisation, saving lives.